Hello, my name is Madison Huber, and I am a senior studying advanced medical imaging technology in the College of Allied Health Sciences. I am nuclear medicine certified, and I will be presenting on the role of MRI and ultrasound in imaging rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease that causes severe inflammation and damage to the synovial joints. The best two imaging modalities to visualize this pathology is ultrasound, also known as US, and magnetic resonance imaging, also known as MRI. Ultrasound uses sound waves to detect bone density and measure the thickness of cartilage in the joint spaces, whereas MRI uses magnetic frequencies to visualize anatomical structures. Both of these imaging modalities complement one another, offering information the other does not provide, and yet coming together to give unparalleled information that is vital through the duration of the disease. The purpose of continuing to study rheumatoid arthritis is because every 5 to 50 per 100,000 people are diagnosed with this disease annually. This disease is 2 to 4 times more likely to present in a female. This pathology leaves patients with severely damaged joint spaces, often incapable of movement, along with physical deformities. There is no cure for this disease. However, MRI and ultrasound are both necessary components in the diagnosis, staging, remission, and treatment of rheumatoid arthritis. It is important to note that this autoimmune disease has an uncontrollable and wildly unpredictable flares. When a patient is presenting symptoms suspicious of rheumatoid arthritis, an ultrasound will be the first imaging modality to be ordered. The ultrasound will provide a disease activity score, also known as DAS, which will give a quantitative number that will stage the disease depending on the score. This then will determine if the patient is positive for the disease. If a patient is positive and/or if the DAS is too close to call, an MRI will always be ordered next to assess for biomarkers and anatomical damage. Both ultrasound and MRI play a significant role in the diagnosis, determination of remission, and follow-ups to monitor the progression of joint damage. Ultrasound detects synovial hypertrophy, which allows radiologists to numerically measure the disease activity through forming the DAS score. Oppositely, MRI displays skeletal damage, cartilage thinning, tendon rupture, regions of inflammation. If you can please direct your attention to figure A, B, and C. Figure A shows a sagittal ultrasound of a finger with an arrow indicating the region of inflammation. Figure B is a sagittal MRI of the same finger with an arrow also indicating the region of inflammation. And lastly, figure C is an axial image of the same finger in both A and B. This is an MRI with an arrow also indicating the region of inflammation. These figures show a joint space in the finger being attacked by rheumatoid arthritis and the swelling that accompanies it. There are pros and cons to both ultrasound and MRI. An advantage to ultrasound is that it is less expensive, time efficient, and it develops a DAS along with evaluating joint space for inflammation. An advantage to MRI is that it images bone marrow, the thickness of cartilage, skeletal anatomy, biomarkers, which are key for diagnosing rheumatoid arthritis, and it also allows for an overall assessment of the anatomical and joint space damage. Disadvantages of ultrasound include inability to show bony structures, damage to joint space, and do not include key biomarkers to help in the diagnosing process. Disadvantages to MRI is that it is more expensive, time-consuming, and you are not able to obtain a DAS from MRI alone. The equipment that made this study possible include an ultrasound and MRI machine. Limits in the study that I found through research is a lack of research on rheumatoid arthritis as a whole. There is no cure for rheumatoid arthritis, so it is hard for researchers and medical professionals to understand the origin of the disease, making it complicated to diagnose, monitor and slow the progression of, and form treatment plans for rheumatoid arthritis patients. I also noticed through my research that not a large variety of patients were being surveyed in the studies. Each research study would have no more than 70 subjects participating. More research and more subjects to survey will provide more information, thus more to learn about the disease. In conclusion, ultrasound and MRI have proven paramount in the diagnosing process of this disease. Ultrasound gives an algorithm to help grade the inflammation of the joint space, and MRI visualizes biomarkers. Both of these modalities are necessary in the diagnosing process of this pathology. Both imaging modalities provide monitoring during the duration of the disease to assess for worsening and/or improvements to the anatomical surrounding structures, while also assessing for structural changes to the anatomy. These imaging modalities are both working together to improve the quality of life for each rheumatoid arthritis patient. This concludes my presentation. Please feel free to leave comments and questions in the comments section below, and I will try to respond to them in a timely fashion. But thank you so much for listening, and I hope you all have a great day.